हाय गाइस, आज हम लोगों के डिपार्टमेंट की कॉन्फ्रेंस है जो इंटरनल डिसीजेस का डिपार्टमेंट है उसकी
मल्टीडिसिप्लिनरी
पेशेंट
पेशेंट्स की।
Surgery and facultative therapy and endocrinology. I think this is range of different directions of our conference, and we have direction rheumatology, cardiology, surgery, what else? Psychology, even psychology, geriatrics, endocrinology. I think it promised to be very interesting, wonderful, and I believe it will be very useful for every of you. Our plan.
Disease. For the full treatment of this patient, a joint multidisciplinary group of cardiologists, pulmonologists, and sanitation was required.
Speaker is Mr. Shalini Khamshian. Yes, I told correctly. Student of mine here from Department of Internal Medicine from our department.
Dansha from group number 502. My subject is related to endocrinology and my topic is autoimmune.
Systemic lupus erythematosus based on the group of patients from Orenburg region. Speaker is Povetkina Elizaveta Mikhailovna. She is student of 4th year, Department of
lupus nephritis. So could you name one symptom in these patients, the 72 or 79 patients who saw at least, the most common symptom which we can see to diagnose SLE faster so that it does not progress to lupus nephritis? Symptom, any common symptom in systemic lupus erythematosus which we can see to diagnose SLE early symptoms. And lupus nephritis is the last stage which can cause death. It is the most common cause of death in patients with SLE. So I just wanted to ask if you have observed any symptoms to diagnose SLE faster so that it does not progress to lupus nephritis.
Early diagnosis. Early symptoms.
Nephritis. For lupus nephritis, we can how we can say that we can find autoantibodies.
Science, student of 5 years, Department of Internal Medicine.
Osteoarthritis. So if we talk about the osteoarthritis, first of all, it is a misnomer. Osteo means the bone, arthritis is the joint, and itis is the inflammation. But it is not a type of
Arthritis has some different symptoms and osteoarthritis has symptoms. So on the basis of clinical manifestation or any specific autoantibody, can we differentiate osteoarthritis and rheumatoid arthritis?
Analysis, you can find the rheumatoid factor present in the patient of the rheumatic present of the anti-rheumatoid antibodies can also be present in the rheumatoid arthritis and not in the osteoarthritis. Since osteoarthritis is not an autoimmune type of a disease, so we cannot see any of the antibodies is present.
Research of the common clinical features and collaboration of so in this method we collected data of 120 patients from the Orenburg.
My research was based on osteoarthritis exhibits. In this, the main aim of my study was to analyze whether there are any differences between
pulmonary hypertension and association with antiphospholipid antibodies. And for this, first of all, let's start with the background of our disease. So pulmonary hypertension is the leading
disease, and this is a wear and tear disease of the aging. And there are generally 4 types of phenotype: aging, metabolic, and post-traumatic, as well as mixed. Then my aim is of study is to study the
etiological factors. Multi-etiology can be idiopathic, it can be due to obesity, it can be due to any trauma, post-traumatic. So in this we are mainly focusing on the quality of the
Tender points. Then second is this scale, which is the symptom severity scale. And third one, there should be the presence of one more 19 10.
Like structure of the acute myocardial infarction. So the target for our poster was directly to see what kind of complications we can find in
Beginning stage, for example, if I take pneumonia is a very high disease which can be fatal. But the symptoms of pneumonia that can be cured at the basic stage, like for example, we can be cured
our principal, student of 5 year, Department of Faculty of Surgery.
Good afternoon everyone. Myself Nishala. My group number is 504. Today my topic is findings for surgical treatment of hiatal hernia and my scientific supervisor.
And what is the most common syndrome it can have due to the esophageal perforation?
Thank you for your question. If there is perforation, hiatus hernia, it is mainly asymptomatic. Okay. If we have any complications, then we can feel like there is symptoms of dysphagia, which is
What is the most common syndrome the patient can have? If along with esophageal perforation, patient have crepitation in the chest and along with mediastinitis. So what is your diagnosis?
like you are talking about differential diagnosis.
And how do you think what is this?
And Borrelier syndrome, because due to the decrease in the intrathoracic pressure, the air will go to the mediastinum and it will lead to the mediastinitis, and the most common syndrome is Borrelier.
So I am Chaitanya Pandey, student number 4th year, group number 413. So here's the case of a congenital central hypoventilation syndrome. So starting with it is a Orenburg syndrome. It's an extremely rare genetic disease characterized by violation of autonomous respiration and as a result of abnormal reaction of the body to the hypercapnia and sleep. So why it is known as the Orenburg syndrome? Firstly, starting with the Orenburg syndrome, congenital central hypoventilation syndrome. It is a rare and genetic disorder characterized by lack of autonomic control. Coming to the history, scientists could not explain its reasons, but Sevinidis and Mitchell described this disease. And also, there is a defect in the gene PHOX2B, in which there is a combination of the Orenburg syndrome and Hirschsprung disease. Coming to the etiology, firstly, it diagnoses more of complications will be there and less survival rate and increased morbidity and mortality. And it is difficult to find the cases of this disorder because it is already a very rare genetic disorder. So I found only 2 cases that was provided by the HOD of the pediatric department, Larissa Bobo, so I am thankful to her, and 1 case from the India. So that's all. Thank you.
Questions? Have you any questions to speak here?
In Orenburg presences syndrome. Yes, ma'am. Only 1 case was registered in Orenburg hospital. No, actually, ma'am gave me the.
Okay, so in Orenburg, please.
What is the differential diagnosis between obstructive sleep apnea and congenital hypoventilation syndrome?
Firstly, differential diagnosis, it can be a case of the hypercapnia, in which we need to measure his blood oxygen level by using a test in which we can measure his oxygen saturation. And also it might be a case of the Hirschsprung disease because most common symptoms are associated with. And also one more syndrome combining with the congenital central hypoventilation syndrome and Hirschsprung disease, commonly known as the Haddad syndrome. So we need to firstly diagnose it by using the laboratory parameters and blood diagnosis test.
This is for the very first time that after 5 years here in Orenburg, this was the year when I got an opportunity to actually take part in scientific conferences and get a view of how actually research is done. So after seeing that in this university, we are taught how we can do research and how we can develop ourselves as a future clinician, but also as a researcher, it was a wonderful experience. And because this was my second presentation, it helped me in gaining confidence and also understanding what is required from a student and what is required from a future researcher or a future clinician. So thank you so much for giving us this opportunity. Thank you.
Our dear students and my colleagues, I want to say, and I always tell to my students that to be a great doctor, it's not only your practice in office or in departments, yes. It's only one part. The second part is our big scientific work, yes. And now you know how it looks like, yes. The next step is your teaching, yes, like ours, yes. It's the third part of your medicine life, yes. Medicine is a difficult, yes. And I think you become a very great doctors, and you do not forget our Orenburg Medical State University and us, and I think we continue our work in this year in summer practice, yes, and I think in next year we can continue our work, yes, in our scientific department, so congratulations.
बोलोगे नहीं क्या कुछ?
बहुत डर लगा आज फर्स्ट टाइम कॉन्फ्रेंस पे, मे बी नेक्स्ट टाइम से डर ना लगे।
हैपेंस।
पूरे कोलिनर्जिक रिसेप्टर एक्टिवेट हो, कोलिनर्जिक क्राइसिस।
Invariance, yes? Okay,
Очень важное ваше сообщение. Да, все вместе, вы молодцы, поздравляю. Теперь на этом месте, да? Тоже очень важный ваш доклад, для нас незнакомый. Теперь будет у нас хирург. Поздравляем. Дальнейших успехов. Поздравляем. Молодец. Умница. Поздравляем. Большая работа проделана. Теперь уже хороший доклад, ответил на все вопросы.
Congratulations to the Urvashi दी. Thank you. First place के लिए आपका पोस्टर था ना?
Thank you. Yes. सौम्या ज्योति पेलर। अपना फीडबैक दे दूं, आज इतना मैं मतलब धाराशाही हो गया था ना, इतना डर गया था क्योंकि ऐसा कभी मैंने बोला नहीं है ऐसे स्टेज में। नहीं, बट मेरे को इतना डर लग रहा था, मेरे को कोलिनर्जिक क्राइसिस हो गया था, स्वेटिंग।